The number of Hoosiers getting treated for COVID-19 is now climbing. Hospitalizations are up a whopping 150%. And Dustin, this is just in the last 5 weeks. And for many in healthcare, as you can imagine, to see this again, it really does feel like deja vu.
Yeah, they have been feeling this. They've felt it. They're feeling it again. That's because this time last year we saw a similar trend. Our Lauren Kostick checks in with local hospitals this week as this surge continues to grow.
It's been 1 year since the COVID vaccine was shipped to hospitals across the country, giving hope to ending the pandemic. But this winter, healthcare workers face yet another surge.
The numbers I'm seeing for ICU bed availability across Indiana are scary.
And this is causing many hospitals like Eskenazi to refuse incoming patients.
Every day, every other day, hospitals are coming on and off diversion as they're able to get patients discharged. Quickly, new patients fill them right back in.
And last week, IU Health requested assistance from the National Guard for nearly all of its hospitals.
We were watching the numbers go down, and to have them turn back around and start going up again is just about the most disheartening thing.
Across the state, more than 3,000 Hoosiers are in the hospital with COVID. That's the first time in nearly a year medical teams are taking care of that many patients. The last time this happened was last December, before anyone was fully vaccinated.
What we really want to see is infections start going down, so then hospitalizations will start to go down after that, and that will give us some relief to the hospital systems.
Right now, new infections have leveled off, and the hope is that hospitalizations will follow. But it's not clear yet what the new Omicron variant will do, and hospitals are already over capacity.
Unfortunately, I just came back from the hospital. It's actually gotten much worse. I can't stress enough how dire it is in the hospitals. Each of our hospitals is above capacity.
Dr. Romuletti says at the beginning of the pandemic, the hard decision was deciding who gets a ventilator. Now it's deciding who gets care.
There's going to come a day, probably the next 2 to 4 weeks, and even if we don't do a single surgery, we won't have enough beds. And that's not just for our hospital, for the entire central Indiana.
And the Omicron variant continues to spread across the country. Doctors say it's only a matter of time before it takes over Indiana. And even though the symptoms are mild, it's still very contagious, which means more people ending up here at the hospital.
Right now, more than 20 hospitals in Indiana are receiving help from the National Guard. That's 7 more than just last week. Many citing staff shortages and just overall exhaustion. Healthcare workers say the best thing that you can do to help them right now is to go get vaccinated. And if you are vaccinated, to make sure you get your booster too. And
we have much more on the hospitalization numbers, the number of cases, what you can do to protect yourself against COVID-19. It's all on our website. Go to WTHR.com/coronavirus. Angela.